My name is Diane Gatterman. I'm a psychotherapist and a bariatric surgery patient. I wanted to talk today about balance. You may have noticed that I posted a medicine wheel, a picture of a medicine wheel, up on my Facebook page and on my Twitter site. The reason that I did that is that I find that the medicine wheel is a very useful tool. If you're unfamiliar with it, it is actually a traditional indigenous tool that's used not just for healing, but also used to represent things like the different directions and the different elements, also the relationship between mind, body, spirit, and the community. In this case, I posted a particular medicine wheel, which the quadrants are mental, emotional, physical, and spiritual, because I think that that's a helpful thing to think about when we're thinking about staying balanced. I think that the nature of having this particular surgery can really flip somebody out and have them focus really in an intense and kind of unhealthy way about how much do I weigh? Did I lose weight? Did I gain weight? Oh my God. Will I start to go back to what I was? Will I ever be what I want to be? How will people see me now? Other people become involved sometimes in that process of asking, so how much weight did you lose? And it can be a judgment of, is it too much? Is it not enough? Um, you know, it's it's really hard to stay balanced on your journey if you're listening to other people and their opinions, or even if you're asking yourself negative questions that, based on what other people's opinions might be. That's really not putting yourself in a balanced and healthy position. I was reading this article the other day about couples and about how men and women differ. And I don't want to generalize because I hate doing that, but in this article, anyways, it said that men feel that they're valued when they're told that they did something that was helpful, that they're being supportive and helpful, and that they're contributing something, they're doing a good job. Women, on the other hand, apparently feel valued when they're told they look good, that they are keeping up their part by keeping up appearances literally. Um, I read that in reference to doing couple therapy, and I thought, gee, that's really interesting and sad at the same time. Um, and having, coming back to the bariatric surgery, having had the surgery, I've done a lot of reading on patients' reactions and how people dealt pre-op and post-op. And what really strikes me is how easy it is for people to get caught up in the physical, as if there is no other part to them that matters. And I find that sad. I find that really sad. And I know before I did this journey, I journaled a lot. I knew that this, it was very possible for me to be kicked off my space and to feel very unstable and ungrounded after having the surgery. I'd seen it happen to a number of people, read about it happening, and that the possibility of that going on, it was very strong. And one of the things that I kept writing over and over again, in this journal that I was hoping to help me along my way, was, drawing the medicine wheel over and over again and reminding myself, you are more than your physical state. You are a spiritual being. You are somebody who thinks. You are somebody who feels. Um, yes, I certainly look a certain way, and my health is important. Um, you know, I certainly wanted to feel better, but I really wanted to and have pretty much, been successful at grounding myself over and over again. And I say that in the way that you don't, you don't ground yourself and stay grounded. That's not human nature. I think it's normal to go off balance. I think it's normal to go on this journey and to, spend some time going, wow, okay, I look so different and I don't recognize myself. Or the other side to that coin, which would be, oh, I think I gained some weight. Gee, I hope I'm not going to gain a whole bunch of weight. Or, how do I look compared to so and so or whatever. And, of course, having, body dysmorphia issues, I think is part and parcel to having done the surgery, which is, not knowing really what your body's doing, how big you are, or how small you are, and feeling you actually look different than you actually do in reality. So there's lots of stuff that comes up with this. I could say that this is true of bariatric surgery patients. I think it's true of a lot of society, that we're not balanced, that we have to struggle to stay balanced. It's it's definitely something that that doesn't come natural in our society. It should, but it doesn't really. We're kind of judged all the time on what we look like. We may even judge others on what they look like. It's there's all these voices in our head that can be very negative and judgmental. I think if we're judging other people, it's because we're judging ourselves. I have never seen somebody who judges somebody else that isn't judging themselves. And truly, the more that we learn to accept and love ourselves, the less that we judge other people, which is, I think, what we're shooting for, right? Is to be a more loving society, to be more loving to other people, and to go out and do good in the world. And in order to do that, you need to stay balanced, or, I shouldn't say stay, because I think it's a constant state of flux, but to focus on wanting to be balanced. And when you go off balance, to say, oh, I'm doing too much of this. Sometimes it's focusing on appearances. Sometimes it's being in a mental state of going, oh, wow, just spent hours and hours reading something or studying or researching or whatever it is. Or, maybe I just spent the whole, I've met people who spent hours and hours and hours meditating, being involved in a spiritual practice. I remember when I worked in the Aboriginal community, this lovely person I worked with, she was, it was an Aboriginal couple, and they were on, doing vision quests and so on. And I remember her so sweetly saying, and so comically saying, okay, enough of the vision quest, do the laundry. And I think that that's about balance, because I know that she really loved that her partner was very spiritual. But there's also, the practicality of, okay, now I need to, balance my life and do other stuff as well. So, and I can certainly find myself doing that, doing those things, sometimes getting caught up in meditating, or getting caught up in reading stuff, or maybe just, being focused on how do I feel, being focused on what do I look like, or I should really work out more, and I think the key is really to be balanced. To try and go, okay, I've done a lot of that. Now I need to do something else. I've noticed let's say, worked out a lot, or I've read a lot, and now I need to incorporate other things in there so that I feel whole and full. And as I said, with the bariatric surgery, I think there's a tendency to feel that it's all about just looks. And that would really throw a person off their balance and really give them, make them feel very unstable. So I would recommend, or suggest, if you will, that you maybe think about those different areas in your life, about the mental and the spiritual, physical, and emotional, and where does that play a role in your life? And what would you like to change? What are you good with, and what would you like to have more of? What maybe do you need to focus less on? What works for you? Everyone's different, and your balance is all about you and what works for you. So that's it for today, and good health to you. Bye bye.